All right, in this section, we're just going to take a look at the autonomic influences on the heart, looking at the sympathetic and parasympathetic and how they actually change the heart rate and contractions and contractility. So if we go back and recall that sympathetic system is coming from T1 to L2, and it's going to come out to that sympathetic chain ganglion, go up all the way to the cervical. So we're going to have those superior, middle, and inferior cervical chain ganglion um, that are influencing the heart. They're all actually going all the way down to T4, coming together. And then those nerves are going to go and influence both the SA node, the sinoatrial node, and the atrioventricular node down here. And that's going to influence our heart rate. You'll notice that they also have a branch coming off down to the ventricular part. This is going to influence the contractility, or how hard the heart actually beats. The parts going up to the upper nodes, the SA and the AV node, is going to influence the heart rate. The other system that we had is our parasympathetic nervous system. And that parasympathetic nervous system is coming from the brainstem. This is cranial nerve 10, or the vagus nerve. And that is going to be coming down and influencing just the SA node and the AV node. And notice that the ganglion are actually on the heart. And so that postganglionic neuron is within the heart, going to where it's finally going to be dropping off its acetylcholine to influence those nodes. So the sympathetic and parasympathetic systems are doing opposite things on the AV nodes, influencing heart rate, and the sympathetic system is going, and only the sympathetic system is going to the ventricular node to influence the strength of that contraction, that contractility. Well, let's take a look at how that heart rate, and we're just going to concentrate on heart rate for the rest of this little video clip. If this is basically that pacemaker potential, which we just saw and went through, for a normal person beating at about 75 beats a minute, so you're going to have 0.8 of a second in between these peaks here. If you have your sympathetic activity kick in, that's going to increase the speed of your heart rate. So how that affects it is going to be right here, that pacemaker potential. And what you'll notice is that that pacemaker potential, one, it's going to kick in a little bit earlier. So you can see that this height is just a little bit, the base of this hyperpolarization period is a little bit higher than the other. But more importantly, it's going to have a shorter duration of pacemaker potential, and it's going to be steeper. So it's going to reach threshold faster. But once it reaches threshold, the rest of the part of this curve right here is pretty much the same as everything else. So we're really primarily influencing this pacemaker potential. So let's just visualize what this looks like with our channels. If we're looking at the sympathetic drive on the drift, what's actually happening is we're having epinephrine, and to a small extent we'll have some norepinephrine going to the heart as well. You'll see that in a lot of the diagrams, but primarily it's epinephrine. It's going to come down, hit that beta-1 receptor. That's going to activate our G protein. It's going to send its alpha over to adenylate cyclase, make some cyclic AMP, makes a bunch of different protein kinases, and those are what's going to come over and activate our HCN funny channels and our T-type calcium channels, and they're going to allow sodium and calcium to come into the cell, and that's going to give us our pacemaker potential. So that's controlling this part of the curve here. So we can also see that this sympathetic drive also influences our depolarization phase, which is going to be from our L-type calcium channels. Again, epinephrine's coming in, making our beta-1 receptor activated, G protein activates adenylate cyclase, make a cyclic AMP, and we're going to have the L-type calcium channels come in, make a lot of calcium. That calcium is going to come in here, and it's going to, these protein kinases are also going to affect the calcium release channels in the sarcoplasmic reticulum, flooding us with even more calcium. Those are going to have an effect on our cross-bridging cycle over here. And it's also going to help with our ATPase as far as bringing calcium back into that sarcoplasmic reticulum. So we got all those things going on, and that's going to improve our depolarization phase. So that's going to be making our cell more positive here. So in a similar fashion, we can take a look at the parasympathetic influence on our pacemaker or nodal cells. And if we look at this as going to be our typical nodal cell potential, the pacemaker potential, and then the depolarization and repolarization. When we have the parasympathetic influence, we're going to be influencing primarily the drift here, the pacemaker potential. So you can see how we're slowing that down. It's taking a lot longer to get from the -60 up to the -40. So let's see how that works. Again, remember with parasympathetic, we're using acetylcholine at both the pre and postganglionic neurons. So postganglionic neuron is going to the heart. We're going to have our muscarinic cholinergic receptor in the heart cells. Those are going to send out our G proteins. And first one we'll look at is calcium. It's going to close those calcium channels. So it's going to slow down our pacemaker potential right over here. So we're not letting calcium in, so it's going to take it longer for it to reach the 40. The other side, on the repolarization, what we're actually doing is opening more potassium channels. So it's going to allow potassium to go out, and that's going to be our repolarization phase. So now we can put this whole thing together. If you've got your typical nodal pacemaker cell, this gray one is going to be our series of action potentials. It's going to take about 0.8 seconds to go from one to the next. If we look at then the sympathetic system, we see we got in this green one, we're getting about 3 different action potentials for every 2 of the normal, typical resting potentials. So it's speeding up that heart rate because we're shortening the drift, or we're shortening the pacemaker potential. And in the parasympathetic system, this purple one, we're lengthening that pacemaker potential, taking it longer to get to the 40, and we're getting just 1 action potential in the time we would normally get 2. So we're seeing how we can really change that heart rate with the parasympathetic system. This just kind of puts it all together in a different kind of way. Here we had the different types of channels that are opening and closing. For our pacemaker potential, we've got our HCN channels, and then our transient calcium channels. We got the long-term or L-type calcium channels doing our depolarization, and then our potassium channels doing repolarization. And on this side here, same exact graph, except we can see the sympathetic system is going to increase or reduce our time for reaching pacemaker potential, and parasympathetic is going to lengthen the time it takes to complete that pacemaker potential. And that's how the autonomic nervous system influences our heart rate.